Good morning, good afternoon, good evening, everyone. You're welcome to today's episode of Public Health in Real Life, a channel and a platform where we highlight key public health issues, we celebrate heroes from the field, and we inspire the next generation of leaders. Today, we celebrate World Immunization Week 2023. According to the World Health Organization, the theme for this year's World Immunization Week is the Big Catch Up. World Immunization Week is celebrated every last week in April. And what it does is it aims to highlight the collective action that is needed to protect people from vaccine preventable diseases. The ultimate goal of World Immunization Week is for more children, adults, and their communities to be protected from vaccine preventable diseases, allowing them to live healthier lives. Our guest for today is an esteemed pediatrician and infectious disease specialist, Dr. Damien Nwaneri. Dr. Damian Iwaneri is a scholar and astute pediatrician with special interest in pediatric tropical infectious diseases, immunization, and public health. He's an associate professor of pediatrics and the acting director of Institute of Child Health at the University of Benin in Nigeria. He also heads the Center of Child Health Research, Training, and Non-Therapeutic Child Health Services. He's been a national course coordinator and a member of the faculty board of the National Postgraduate Medical College of Nigeria, where he has exhibited excellent leadership, communication, organization, and has mentored a lot of colleagues and peers. As a former national secretary of the Pediatric Association of Nigeria, Dr. Nwaneri led and managed projects sponsored by the US CDC and initiated by the American Academy in Nigeria, and these projects aimed at strengthening national pediatric societies on immunization and strengthening the pediatrician's capacity for pediatric tobacco control. He's currently the moderator at the African Regional Learning Collaborative Network and has over 50 published articles on pediatrics and public health in peer-reviewed journals under his belt. You're welcome, Dr. Nwaneri.
Thank you very much. It's a pleasure to have me here in the public health in real life.
Thank you, sir. So to go straight to the business of the day, the theme for today is the big catch-up, like we said. According to UNICEF's State of the World's Children's Report, it said that about 25 million children missed at least one essential vaccine in 2021. Could you please elaborate on why that is?
Well, thank you very much. It's important for us to know here that immunization prevents death worldwide, and that 4 million deaths worldwide have been prevented by childhood vaccination every year. And then when you look through, it's estimated that 51 million deaths could be averted between the year 2021 and 2030. But recently, we also realized that 1 in every 5 children globally do not have access to essential immunization. In 2021 specifically, the global immunization coverage dropped by 81%, and of course, largely due to the COVID-19. And that gave us to the phenomenon that virtually over 18 million children did not have access to a single dose of vaccines, or the phenomenon tagged as zero-dose children. And about 11 million of these children actually located in 10 countries: India, Nigeria, Pakistan, Indonesia, Ethiopia, DRC, Angola, Iraq, South Africa, and Afghanistan. And so permit me briefly to say the COVID-19 could have participated with its devastating effect in the low-income country like Nigeria and some few other ones as mentioned. We had an article that we published during the COVID-19 looking up for the reason for this drop. One was fear of contracting the disease, and so many people did not really come to the hospital, so there was hospital visitation dropped. There was also unawareness that immunization clinics were really running even when things become somehow better. But of importance was the paradigm shift in care of COVID and of COVID patients, with the antecedent neglect to the healthcare services of other disease that are other killer diseases. The other factor that contributed to this included rumors and panics among stakeholders at different levels, including mothers and the caregiver who supposed to have brought these children to the hospital. Then, outright vaccine rejection. For one reason or the other, people just rejected vaccine as at that time, probably due to, especially when the advent of the coronavirus vaccine came up. People rejected the coronavirus vaccine, the COVID vaccine, as well as rejecting the other routine vaccination. And finally, as major contributor to that was logistics problems, including stock out of PPEs. And so some health workers didn't really come to work. And then, of course, most health facilities. And finally, the effect of the lockdown generally now worsened the entire effect. You agree with me that this 81% drop happened to be the largest ever recorded in the last 1 or 2 decades in the history of immunization program.
Thank you so much, Dr. Waneri. And when you put numbers to it, it's really stark. That 80+% drop is significant, especially when you talk about the gains made in, on the five mortality and all of those other stats. With the advent of like the Millennium Development Goals and Sustainable Development Goals. So I want to
Sure.
speak to what you mentioned about the impact of not just the COVID-19 pandemic in terms of supply chains, healthcare worker availability, but then on vaccine confidence and vaccine hesitancy. So what are some of like the strategies that were then used or are still currently in use to address those two scenarios?
Well, the most important here when we talk about vaccine hesitancy, there are three major areas which WHO had mentioned, the three C's we need to look into when we talk about vaccine hesitancy. The problem there is confidence, the first C. The second C there is complacency. The third C is convenience. And so people keep talking, the vaccine safe, effective, how reliable is the vaccine and the component of the system and motivation of the policymakers. Then the fear of possible risk of contracting diseases from the vaccine and then catching disease may impact negatively on the sufferers. Now, what the last C is convenience in terms of getting the vaccine within reach, availability, affordability, accessibility, and of course, real waiting time. Do I really have to get into the health facility and then I get the vaccine as expected? This is actually common in low, in medium income countries where the waiting time appears to be on a very high side because have the healthcare workers client ratio is actually abysmal. So these are some of the issues that we have to look at when we're talking about vaccine hesitancy. But of note is of the issue of culture. In some, especially in Africa, we have challenges with beliefs and culture. Some people believe that vaccine and immunization is just a way for the white race to reduce the population of the black race. And so whatever that they want to put in place to put a stop to that dominance must be done. But we know that that is not true and that's not correct because vaccines have saved quite a lot of lives. For many more children in Africa and other low, medium income countries would have died if vaccines and immunization have not been there. But again, vaccine hesitancy is not just only about low income countries or Africa, but the developed countries also have their own problems. Now, some of these problems raised to the belief that is vaccine really safe? Does vaccine really work? Some other people said we don't need the vaccine. So long as you develop the disease, you have to develop immunity, and that is enough. But of most importantly, some other school of thought talked about the adverse event following immunization. We all know about the issue of the vaccine-derived polio, and then the adverse effect of intussusception and the rotavirus vaccine. But we also know that the number of children that that vaccine had protected and had kept alive far outweigh whatever little percentage that have developed intussusception. And of course, finally, we looked at the relationship between the MMR and, of course, the thimerosal and autism. Despite research, scientific findings that has no really serious connection between MMR and autism, some school of thought still nurture and believe such information, and that has really contributed immensely to vaccine hesitancy, especially among the developed countries.
It's interesting you mentioned or highlighted that vaccine hesitancy isn't just a problem in low and middle income countries, but even in high income countries um, as well. And thank you for really highlighting some of those adverse effects that were reported and how those have further fueled the vaccine hesitancy. I wouldn't call it a movement, but at least the conversation. It's also interesting that you highlighted like all those multi-systemic factors that feed into the health sector and how the health sector operates to provide services. So along those lines, it's evident that misinformation and
Mhm.
disinformation, because those are two distinct things, play a role in vaccine hesitancy. So, what role do you think community outreach programs and education programs at the patient level, at the community level, at the facility level, and at the healthcare worker play in improving vaccination rates globally?
Yeah, when we were talking about health education, of course, the health outreaches and education play quite a great deal in tackling vaccine hesitancy and improving vaccination rate. Community outreaches have been playing key role and will continue to play key role in enhancing immunization uptake in a very great deal. But I would want to say here that one of the major challenges still remain community mobilization and participation. Community mobilization and participation, especially at the conception level of immunization program, enhance ownership and uptake even in marginalized and hard to reach areas. Secondly, I want to emphasize on what I call the focused health education, targeting different groups. For example, remember that vaccine and immunization is not just a childhood issue, but we have adults who have to ensure that they take immunization. Like in antenatal care attendees, if we have low coverage of certain immunization indicators, probably we'll discuss that in the next few minutes, then you must have a focused health education for such individual during the antenatal care, not just routinely, but a comprehensive education on vaccines. Community town hall meetings, engaging the women groups, the men group, religious leaders, the pastors, the imams in the mosque, if we have low pentavalent vaccine, and then as well as if there's a high dropout rate at any stage. Again, like I said, these are immunization indicators that we may be looking at in the next few minutes. Then we will also want to look at facility-based education if you also realize that there's a kind of a huge dropout in that facility, and then address specific causes of hesitancy, especially as regards to adverse events following immunization. So these are specifics. Finally, we may be looking at tracking and reminders as an avenue that can help us to tackle hesitancy. I wouldn't want to end this session without talking about what I call the cycle phenomenon. And that is, as stakeholders, pediatricians, physicians, nurses, other healthcare providers, community health extension workers, every opportunity you have in your routine work, ask about a child's immunization. By so doing, we will be able to identify challenges, identify missed opportunities, and at the same time, trying to address some of the issues I've mentioned. Then we also need to follow due process, following the ethical processes involved in demystifying the belief that the individual, has already built up, because you can't just move up there without really, demystifying the information provided. If somebody had believed that vaccine causes sterility and then infertility, so you have to develop an avenue to really convince the individual that vaccines are safe, they prevent diseases, and they help to ensure that our children and, of course, the adults who are at risk of certain diseases live a healthier life.
Yeah. And we will touch on, cycle like you mentioned in a couple of minutes, just as we talk about, what the role we all play in the big catch up. But I wanted to go back to the issue of some of the adverse events you mentioned and vaccine safety and ask you, from a provider standpoint, especially if you are communicating with a concerned parent or a concerned population, how would you assess vaccine safety and what advice would you give to, concerned stakeholders who are questioning vaccines?
Yeah, the point here is that the vaccine safety is a very huge phenomenon, and it's not. It's most times it takes several years in rolling out a vaccine. Vaccines are not just rolled out in one day, and so vaccine safety involves clinical trials that are done, several times. Vaccines are tested before they are recommended for use. And of course, before a vaccine is ever recommended for use, it is tested in laboratory. Of course, the process takes in several years in collaboration with the in-country agencies. And different in-country agencies have their protocol, before that vaccine could be rolled out. Nevertheless, I want to say here that during the clinical trial, the vaccine is tested on people who volunteer to get vaccinated. And then, of course, usually start with 20 to 100 people, and eventually including thousands of volunteers. And questions answered during those processes include: is the vaccine safe? What could be the dose that will be able to work? How does the immune system react to the vaccine? Any adverse effect? And no matter how little that adverse effect, even when it is not linked to the vaccine, has to be documented. Okay, just to let you know that, look, it could happen, because we know that even the introduction of the vaccine itself is also a process. Pain is an adverse effect, okay, on the site, which may not necessarily be in connection with the vaccine itself, but it has to be recorded as part of the, event that could happen in the process of the vaccine. Of course, monitoring and evaluation during the process. And so in day-to-day activity, in either in public health programs, town hall meetings, even in the social media, or like we mentioned, day-to-day clinical assessment, is the ability to convince the mothers the benefit versus the risk ratio in, first of all, taking the vaccine, and of course the benefit of the vaccine in preventing the disease, and of course the outcome if the individual has not taken the vaccine. And so we look at those who took the vaccine and those who did not take the vaccine, and we perform statistical real-time statistics to show diseases have been on the downward trend. And for sure, many children who would have died wouldn't have died if they were vaccinated against most of the common childhood killer diseases. And so in the routine practice, on day to day, every contact we have with the mothers is ability to convince them with real information that vaccines are safe, after we have gone through all the rigors of providing the vaccine, recommending the vaccine, approving the vaccine, and rolling out the vaccine. And it takes quite a long time to, before these things are done. And that also helps to checkmate the safety of the vaccine and effectiveness of the vaccine.
Thank you for highlighting those, Dr. Damien. You touched on SICA earlier, and I wanted you to, or I want you to expand on that a little bit more. And then following that, we would talk about the implication. The theme is the big catch up. That means it's almost this race against time. So what should we anticipate if we don't meet that big catch up? What are the consequences of that, or the implications?
Well, as I mentioned earlier, it is estimated within the next 10 years, 2021 to 2030, 3 years had already gone, that we will be able to save over 50 million children from childhood killer diseases. And remember that the gains which we have had pre-COVID era had actually been lost due to the factors mentioned earlier on. And then having almost additional 18 million people, children especially, who had zero, meaning that they've not obtained any vaccine at all. And these children, majority of them are located in low and medium income countries. You will agree with me that we have barely 7 years to meet the target. And that's why the big catch up is there. All hands have to be on deck. to ensure that we'll be able to meet the target, to ensure that these zero dose children are actually lifted up from the zero level to the point of completing their immunization. Remember that taking one vaccine in the schedule is not equal to having full immunization coverage. And that's how the cycle phenomenon, what I call the cycle phenomenon. I use the cycle phenomenon where every health worker, any contact you have with patient, in your discussion with patient, trying to find out, the illness, especially in children, obtain a more focused immunization history. It's a one-on-one phenomenon, on daily basis, and then being able to also hear the challenges the mothers are facing, routinely in having access to immunization for their children. And this information will go a long way to address some of the challenges, because the challenges, they are not just only about the patient, the caregiver, their beliefs, their culture, religion, gender, or geographical location. Sometimes the healthcare system also has its own challenges, especially in the low, medium income countries where you have stockout syndrome, several public holidays. A woman had immunization, the child is supposed to have immunization on a Thursday, and that happened to be a public holiday, and is missed. And most times, the mother may not even return, and there is no mechanism to track those children, and they are missed. So these are the major contributors to in the system itself that could contribute to the reason why we're having challenges with low coverage and, of course, uptake. So it's not just only about the clients, but also the system. And that is why on daily basis, in our day-to-day routine, whether consultancy services, technical support, we should be able to, or even in the supervisory role of healthcare providers at all levels, we should be able on one-on-one obtain what we call focused immunization history. And that's what I call the cycle phenomenon. And by so doing, we will not miss any child, especially when he had contact with the healthcare system. We won't be able to miss that child.
Yeah, yeah. It's interesting how you mentioned the zero dose phenomenon, and how the role everyone plays in the big catch up. Touching on that, it's estimated that 1 in 5 children have
Mhm.
zero dose or are under vaccinated. And you touched on the system and how that practical example of a child has an immunization and then it's public holiday. So the question then is, what role would public private sector partnerships play in closing that gap, in ensuring that the system is responsive to the needs?
Oh, wow. If you look at some of the things, even this week during the this immunization week, we talked about partnership and we talked about collaboration. The public-private partnership has a huge role to play in immunization coverage, and I would want to start with the vaccine itself.
Mm.
The provision of the vaccine itself is a collaboration of the PPP, the public-private partnership. I remember in 2018, I was among the delegates that attended the meeting with Gavi when the chairman visited Nigeria, that eventually extended the vaccine support to Nigeria, to the next 10 years up to 2030. And I know that the in-country may not necessarily be able to foot the huge bills on vaccine. Of course, vaccines and immunization, the receivers or the client receive most of them free. But the point is that there is no free lunch anywhere, not even in Freetown in West Africa. And so for every free lunch you are getting, somebody is paying for it somewhere. And that is where the private public partnership comes in, because donors, the private donors, put in quite a huge amount of investment, of course, with counterpart funding from the government, from the public funds to support vaccination. So I want to start from there as a huge collaboration, to that effect. I also want to look at partnership in terms of health education. Partnership in terms of health education is very important in the sense that there are several other places, hard to reach areas. In some low and medium income countries, we have quite a lot of problems, such as insurgency, so that even when the healthcare providers may want to go there, but because of vulnerability of the community, of the society. Let me give an example from, for example, in Nigeria, in the northeast, where we had problems with insurgency, militancy in the south. Those children in those areas actually had problems with vaccine. But when the private, well, vaccine and other healthcare services, but when the private joined hand with the public, those areas were reached. I also remember that in the far northeast, like Borno and Yobe in Nigeria, about 5 years ago, the data were almost absent or on a very low side because of these insurgencies. But by the help of the partners and then of course governmental and non-governmental organizations, multinationals like WHO, UNICEF, and other great partners, huge funds were pumped into those areas. And then that improved healthcare services across board, including immunization, such that some of their health indices actually improving and getting better than some other places that did not originally have the insurgency. And that is the beauty of the public-private partnership. So in health education, it's very important. In routine services, it's important in provision of commodities. And finally, of course, in training healthcare providers. Before any vaccine is rolled out, the healthcare workers have to be trained. I remember that Gavi and some few other with WHO and UNICEF, especially when as regards to the, remember Tuesday was World Malaria Day, and we talked about rolling out the malaria vaccine. Of course, before then, before this time, workshops, training committees have been set up, in several in concerned countries, training healthcare workers in preparation for the rollout. These are the beauty of the public-private partnership in sustaining and stabilizing the healthcare system.
Speaking of sustainability, because that's a huge factor, we will go a bit and touch on bright spots. So, what can you remember or just highlight a immunization campaign or program that you were part of that was very successful, and what were some of the lessons learned and gains from that could be leveraged for the big catch up?
Oh, thank you very much. Here, we've been involved, of course, in our routine daily practices, especially in the Institute of Child Health, where we work, ensuring that the children are getting their vaccines and being immunized. But I want to touch one when we had measles campaign, measles vaccine campaign, that was in 2019. And of course, like Riley mentioned, the government and stakeholders, partners, multinational, UNICEF, WHO, and of course, civil society organization and professional bodies. Then I was the secretary of the Pediatric Association of Nigeria. It was a huge success, and one of the reasons, one of the major contributors include that situational analysis by determining what could be our catchment areas and immunization coverage in that particular area. Then we also looked at interpreting the coverage data for possible action, and we appointed the people we regard as vaccine monitors. But before then, we have also worked in collaboration with the American Academy of Pediatrics to train individuals we called vaccine immunization champions, first at the national level and of course at the regional level. And then we were able to select state monitors across board. So you find out that at the national, at the regional, and of course at the state level, we were able to have a kind of a step down, from the top to the bottom. And then these state monitors now get to the grassroots, which is the community. And most times they render consultancy, technical support and services, supervision, and then sometimes participate in real-time participation, on the field. And looking back, it was a huge success because for us as civil society organization or professional bodies working in collaboration with American Academy of Pediatrics and the Nigerian government, we're able to reach out because we work with the National Primary Health Care Development Agency of Nigeria, and we were able to reach out to virtually all the areas that needed to be covered in that particular year against the measles, the disease. For me, it was a very huge success. And I will really remember that. And if you look at what created that success, is a more or less a huge collaboration across board. The government, civil society organization, professional bodies, and of course, multinationals playing their key role, and we're able to reach out even to the hard to reach areas or the marginalized individuals.
Thank you for sharing those lessons learned. We can definitely tell you're very passionate about this work with your expertise and experience. So, could you just tell us what inspires your work and what keeps you up, at night, and what wakes you up in the morning and inspires what you do?
In reality, I like seeing children. Let me put it this way: they asked an African child, what will you be when you grow up? And his answer was to be alive.
Mm,
So he's struggling to live. While other children, probably in developed countries, have been thinking, oh, I'm going to be a pilot, a lawyer, a doctor. But there, that African child is struggling to live. And that's when we talk about the child survival strategy. And so, how can we make these children to be alive so that they can now be useful to the community? That's what keeps me going. Secondly, I will want to treat the every child equally. I keep telling people, even in my routine practice, the way I treat the child of Professor and Professor Mrs. the same way I treat the child of a farmer and farmer Mrs. And that is because, irrespective of gender, ethnicity, religion, geographical location, these children, if they are properly trained, if they are properly handled, if they are properly taken care of, they will grow up to become great game changers in the society. And that what drives me, that what gives me that passion. And for every child, as even in my routine practice as a pediatrician, in acute phase, a child is dying, and you do the right thing, following the due protocols. In the next 48 hours, 72 hours, the child is up again, smiling at you. My heart is filled with joy, and that's what drives me, and that what drives my passion, keeping me all day, all night, doing the little research we could do to improve the healthcare services so that these children can live.
Thank you for sharing that very heartwarming anecdote, Dr. Waneri. You're very correct in terms of with the child. Yes, they'll probably fall ill in hours, but just the way they quickly recover and have smiles, the bundle of energy, it's really heartwarming. And you are absolutely correct that children are the future, and every child deserves the right not just to live, survive, but to thrive. And we have to make sure that our children are equipped to take up the mantle, and not investing in children's survival and their welfare and well-being is actually a detriment to any society or any nation. So thank you for highlighting your passion. We talk about the big catch up, we talk about the role everybody plays, and we know advocacy plays a huge role in ensuring that we move the needle in making decisions. So what role would every one of us play as advocates to ensure the big catch up?
Stalking, speaking, influencers, changers. We are all agents of change in all ramification where we are. Every opportunity we have to bring forth the desired change, please, I want to encourage every one of us to do so. We are all stakeholders in this business. The child is a stakeholder. The mother or the caregiver is a stakeholder. The healthcare provider is a stakeholder. The government is a stakeholder. The hospital, the multinationals, the vaccine providers, the vaccine monitors, the vaccine professionals, they are all stakeholders. If there is any gap along this chain, starting from the receiver, the child, up to the highest level of supervision, things wouldn't really work out well. And so I encourage every one of us to be the mouthpiece of the children. And if we look at who truly will want to speak, those of us who are at that level of the stakeholding level should play our key role. I also want to talk about collaboration. I know you mentioned last week, you mentioned earlier on about collaboration, especially in the African Regional Learning Collaboration Network, where we learn from one another, what we call peer-to-peer learning collaboration. We look at what is happening in the North and look at what is happening in the South, look at the differences and see how we can replicate what is happening in the South, what succeeded in the South, whether it can succeed in the North. So the same way, what is happening in Ghana, and Ghana is recording a good success, can we replicate that even with slight modification in Nigeria and see how it works, and so on and so forth. And so is a big thing about advocacy, and advocacy can go throughout all levels. Let me finally mention here that the community influencers may not have even been have formal education.
Mm.
Some of them may not have formal education. Some of the women leaders may not have had formal education, but they are a huge force to reckon with. And so if we're able to have powerful, wonderful advocacy on vaccine acceptance and uptake, that single woman could be able to convince other thousands of women in the community. If you're also able to convince with real-time information and data to that pastor of that religious group or that imam of that religious group, I can tell you, he can change the entire community. So he is an agent of change, just like every healthcare provider is also an agent of change. And we should see how we can bring these, despite it may look inhomogeneous, but we can bring this group of people together and we can speak one voice. And when we speak one voice concerning vaccine is safe, vaccine saves life, vaccine prevents diseases, and of course, vaccine should be accepted so that we can improve on on vaccine uptake and coverage. That message can go down to the grassroots, even to the lowest of the clients you can think of. And that's the beauty of advocacy. And that's why even this week, we've been talking about partnership and collaboration in the field of advocacy as one of the keys that will enable us to meet up with the catch up, which is the theme for the World 2023 World Immunization Week.
Thank you so much, Dr. Waneri, for sharing that. As you speak so passionately about this, I'm reminded of the words from Whitney Houston's song "The Greatest Love of All," and where he talks
Mhm.
about, the children are our future and all that, and that we really need to invest in our children's welfare and well-being. To our audience watching, thank you all for taking the time to just hear the words of wisdom, the passion, and the advice from Dr. Waneri. And please like and subscribe the Public Health in Real Life channel and follow Dr. Waneri's work. And speaking of following Dr. Waneri, for people who are watching and who watch this after, who want to reach out to you and support your work, what are the different platforms and channels they can connect with you? Yeah, so
Hello?
was yeah, is there any way people can reach out to you, Dr.
Oh,
Waneri,
yeah.
if you want to connect? Yes.
Yeah, it could be on LinkedIn, and of course, you can also go through email, official email of the Pediatric Association of Nigeria, and of course, the Institute of Child Health, University of Benin, um, based in Nigeria, where we are actually doing our routine work on immunization, including research on immunization. So these are the two areas that can be contacted. My email address, of course, is there, and of course, the official email of the two institutions. Institute of Child Health, University of Benin, Nigeria, and University of Benin Teaching Hospital, and of course the Pediatric Association of Nigeria, and we'll be able to follow through where some of the works we are doing.
Thank you so much, Dr. Waneri. And to our live audience, please feel free to follow us on Public Health in Real Life, where we have the pleasure of bringing esteemed guests like Dr. Waneri. And please feel free to give us feedback on, topics you would like us to highlight, guests and heroes that Dr. Waneri you would like us to celebrate, and just key issues that you would want brought to the forefront. For everyone, as we wrap up World Immunization Week, the work isn't done. Please let's all play our part in the big catch up and stay safe and be well. Bye, everyone.
Thank you very much, and bye for now.